Okay, so we're going to pick back up now with part two of the endocrine gland. And so I'm basically picking up where we left off on the first video. So here we are with the adrenal glands. And so this is our next major endocrine gland that we're going to talk about. And the adrenal glands are these two little glands that sit right on top of the kidneys. So if you remember when we talked about blood vessels, we had the renal arteries and veins that went to the kidneys, and then we had these little tiny separate vessels called suprarenal arteries and veins. And I talked about how they go to the adrenal glands, but we hadn't talked about that yet. So just for those of you guys that we made that connection in lab, well, here's your adrenal glands, and they're part of the endocrine system. And so what's interesting about these guys is that they're actually two separate glands. So we're going to have within each adrenal gland, we're going to have an adrenal cortex, which cortex always means crust. So anytime you see a cortex, it's always going to be kind of this outer part of whatever gland you're referencing or whatever organ you're referencing. So the cortex is going to be the outer part of the adrenal gland, and then we have the adrenal medulla, which is going to be the center part. So technically two separate glands, and they do two different things. So let's talk about those individually. The first one that I want to talk about is the adrenal cortex. Okay, so this is going to be that outer crust of the adrenal gland. And the major hormone here, there's actually a lot of different hormones that are secreted by the adrenal cortex. I basically just pulled out one major one that we're going to really focus on, and this is cortisol. Okay, so cortisol. Cortisol is important because it's a hormone that's released when we're stressed. Okay, and stress in a lot of ways is very good for us. So it's good for our body. A certain amount of stress for a certain length of time is beneficial and it's healthy. Where it becomes problematic is when it's high levels of stress for a very extended period of time. And we'll talk about the effects that elevated levels of cortisol for an extended period of time can have on your body. So cortisol, other name for that is hydrocortisone, and some of you may recognize that from medications, and we'll talk about how that plays in too. Okay, so what happens when you're stressed is typically hormones act through negative feedback loops, right? That's something that we talked about in the beginning. So typically what would happen is if you have increased secretion of cortisol, that negative feedback loop would cause production or secretion of cortisol to shut off once it is increased to a certain level. What happens with cortisol is that when you have long, prolonged stress, the brain, the central nervous system, is basically going to override that negative feedback. So where it would typically be shut off, the brain says, no, we're not going to shut it off this time. We're going to continue to release cortisol. And that's where we end up having issues. So what are the effects of cortisol on our body? So here are some of the actions of cortisol. And if you think about the fact that these are released during stress, it kind of makes sense what they do for the body. So for one thing, they're going to increase blood levels of glucose, amino acids, and fatty acids. And this makes sense because we use all of those for energy. And during periods of stress, our body knows that we need building blocks of energy available. It's also going to break down proteins in the body in order to create enzymes that are needed to catalyze reactions or allow us to have building blocks to repair other structures in the body. So it gives us the raw materials that we need to repair other structures. Cortisol is also going to work in conjunction with the sympathetic nervous system, which we know when we have activation of the sympathetic nervous system, it causes vasoconstriction within our blood vessels. And this is going to help our body in stress because it helps to maintain our blood pressure and it helps to make sure that we get adequate perfusion to vital organs. So it maintains a certain amount of pressure to our brain and our heart. But in the long term, this can cause trouble because it can actually generate just elevated blood pressure or hypertension. So we'll see that as one of the side effects. This is where we have problems with cortisol. When we have excessive levels, so basically this is what happens when we have patients or people who are under chronic stress and their brain shuts off that negative feedback. So it doesn't tell production of cortisol to stop. Once it reaches a certain level, it continues to promote the release of cortisol. That's when we have issues. What happens in these cases? So what can happen with excessive levels of cortisol is it can actually depress cartilage and bone formation. So how this is going to affect your patients is if you have someone who is chronically stressed, and we're talking like loss of a job, change in living situations, having to care for a family member who's chronically ill, that type of stress can affect their healing. If they've had surgery, it can certainly affect healing right afterwards. It can decrease the release of inflammatory chemicals, which again is going to affect healing. It's going to depress the immune system. This is why a lot of times patients or people who are chronically stressed tend to get sick a lot. Their immune function is not working like it should be, and it basically disrupts normal cardiovascular, GI function, and neural function in the body. So it has a pervasive effect throughout the body. We see this in people who are chronically stressed. We also see this in patients who use medications that contain hydrocortisone. So this would be long-term use of an anti-inflammatory that contains hydrocortisone. So those levels of cortisol can build up in these patients as well and can contribute to all of these negative side effects. Okay, so here's one example of pathology related to cortisone. And this is what happens when we have excess glucocorticoids, which is the class of hormones that cortisol is part of. And it can lead to a condition called Cushing's syndrome. So there's a couple different ways that you can have Cushing's syndrome. You can either have, you can be taking medication, so like a hydrocortisone type of medication for an extended period of time. And one of the common ways that we see this is patients who are treated with hydrocortisone to treat like arthritis, so chronic inflammatory conditions, or you'll even see it with patients who have asthma. So my husband actually was treated for asthma for a long, long time. He actually didn't even have asthma. They made a kind of a wrong diagnosis, and he was treated with a inhaler forever that had cortisone in it. And so he started to experience some of these side effects until they properly diagnosed him, and then he stopped taking that medication. But that's one example. You could also have a patient who has a pituitary tumor, and that causes increased release of cortisol. So what happens with these patients? A lot of times they'll come in and they'll have this type of appearance. This is basically an appearance of a patient who has Cushing's syndrome. So what we're going to see with them is we're going to see a general elevation in blood glucose levels, which is also one of the things that you have to watch. If you have patients who have diabetes and they are prescribed cortisone medications, like hydrocortisone related medication, it can actually cause their blood glucose levels to spike. And so that's something that you're always going to want to warn your patients about. You're going to see a loss of muscle and bone density in these patients. They tend to retain water or retain salt and therefore retain water. So a lot of times they'll have kind of rapid weight gain, which ends up creating these purple striae, which are basically stretch marks. So you'll see stretch marks. You can see on this person here, stretch marks all through her abdomen and on her arms. Oftentimes these patients present with hypertension, and that's because of cortisol's relationship to the sympathetic nervous system and causing peripheral vasoconstriction, which is going to increase blood pressure. Because of that salt retention, we see edema. Patients with Cushing's syndrome tend to have swollen face because of all the fluid that they're retaining. They also tend to have what we call a buffalo hump, which is going to be through here. If you see patients who basically they're retaining fat in the upper part of their back, and that's how that looks. You can see on this patient here, you can see the buffalo hump here. And then these patients are prone to infections because prolonged elevated levels of cortisol tend to depress the immune function, and so these patients are prone to infections. So this is kind of an interesting thing. And if you're working with patients in any capacity, you're going to see patients with Cushing's syndrome. It is a fairly common pathology. So part 2 of adrenal gland is the adrenal medulla. Okay, so this is the interior part of the adrenal gland, and basically adrenal medulla is connected to the brain. It has a neural connection, and it receives input from the sympathetic nervous system in response to short-term stressors. So while our adrenal cortex is long-term stress, our adrenal medulla is short-term stress. So this is same example that we always use: bear in the parking lot and you're having to run away from it. So the sympathetic nervous system is going to activate the adrenal medulla in response to that short-term stress. And so we're going to see a release of this class of neurotransmitters called catecholamines, and that includes epinephrine. It also includes norepinephrine, but the majority of what's released, in fact, it's going to be about 80% of the catecholamines is going to be in the form of epinephrine. And we know that epinephrine is a potent stimulator. It's going to basically cause effects throughout the body that are consistent with activation of the sympathetic nervous system, your fight or flight response. So we're going to see increased heart rate, we're going to see increased blood pressure, we're going to see increased blood glucose levels, and that makes sense because we're going to burn up that glucose for energy. In the respiratory system, we're going to see bronchial dilation because we need to be able to move air in and out as much as possible, but we're going to see cardiovascular vasoconstriction. So sympathetic nervous system has opposite effects on blood vessels. It vasoconstricts. On the respiratory tree, it's going to dilate to allow more air in and out. Okay, so this is a nice way to kind of put both of those effects together. So here we have, let's start with prolonged stress because that's where we started first. So for prolonged stress, here, this is your long-term stress. You lost your job, death of a family member, that sort of thing. This is chronic stress. We have this series of, this cascade of events that's going to happen where we have activation from originating in hypothalamus because, like we said, the brain is going to override that negative feedback loop and it's going to continue to stimulate the adrenal cortex. So here's where our stimulus is coming from, and it's basically going to travel down to pituitary gland, specifically to anterior pituitary gland, tell anterior pituitary to release its hormones. Those hormones are going to travel to the adrenal cortex and stimulate the adrenal cortex to release its hormones. So if you actually think about it, what type of stimuli is that going to be? That's going to be hormonal stimuli because hormones are prompting an endocrine gland to release its hormones. Okay, so this whole cascade of events is going to be hormonal stimuli. And then adrenal cortex is going to release its steroid-based hormones, which are going to be primarily glucocorticoids, which are going to be cortisol. That's the main one that we're focusing on here. So here's all your effects of cortisol being released through long-term stress. Okay, so increased release of cortisol, which is going to have the effect of increasing sodium and water retention, which is going to increase blood pressure. We're going to have basically glucose is going to be released, which is going to elevate your blood glucose levels. And we're going to have suppression of our immune system, which is why chronically stressed people tend to get sick. Okay. On the other side of things, we've got, this is our short-term stress. So this is basically our sympathetic nervous system reaction. So this is quick stress in response to a short-term stressor like the bear in the parking lot. So what we have here is our stimulus is still arising from the hypothalamus, and it's going to travel down and it's going to innervate the adrenal medulla. Okay, so this is, what type of stimuli would this be? So we had three choices of stimuli. We had hormonal, which is this example here, prolonged stress. We had humoral, which is related to levels of ions or nutrients in the bloodstream. Is that the case here? It is not. We have a nerve impulses traveling from hypothalamus down to the adrenal medulla. So this type of stimulus is going to be a neural stimulus. Okay, that's a great example for that. That's a great test question. So here's our short-term stress response. Increase in heart rate, increase in blood pressure. We have respiratory airways that are going to dilate so we can let air flow in and out so we can run away from the bear. We're going to convert stored glycogen into glucose so that we can use it for quick energy. And we have an increase in metabolic rate. We have blood flow changes. So at this point, is it important for us to send blood to our digestive tract? It is not. So we're going to route blood to our skeletal muscles so that they can work to help us run away. Okay, so this is all stuff that you know before. We're just going to link it into something that is a little bit new. And so that's where the adrenal medulla comes in. Okay, but certainly being able to compare long-term stress versus short-term stress is going to be very, very important. Okay, all right, moving on to pancreas. Pancreas is this little organ here, and it sits right below your liver. And it's kind of interesting because the pancreas has two roles. It operates as both an endocrine gland, meaning it generates hormones and then secretes them into the bloodstream to travel to a distant site and have an effect. And it also acts as an exocrine gland. So as an exocrine gland, the pancreas is part of the digestive tract. And so we're going to talk about that when we do the digestive system. So don't worry so much about that now. Just know that pancreas has two functions, and we'll talk about exocrine function in a little bit. In terms of its endocrine function, the pancreas secretes two types of hormones, or two hormones that are manufactured by different cells within the pancreas. So we have alpha cells that are in the pancreas, and they're going to produce glucagon. And then we have beta cells in the pancreas, and they are going to produce insulin. So these are antagonistic hormones, meaning that they have opposite effects. Okay, so insulin has the effect of hypoglycemia. So insulin is actually going to decrease blood glucose levels, okay? And glucagon is hyperglycemic. So it's actually going to raise blood glucose levels. So in that way, that's what we mean when we say that insulin and glucagon are antagonistic because they have opposite effects. Okay, let's talk a little bit about insulin first. So insulin is a small protein, and basically what it does is it facilitates movement of glucose from the bloodstream. So we've got our bloodstream and we've got glucose floating around in it that we've absorbed from our digestive tract, and it's going to help move glucose out from the blood vessels into the cells of our body. Okay? So we're moving glucose out of our bloodstream into the cells. So in that way, it's going to decrease blood glucose levels. Okay? It also inhibits the breakdown of glycogen into glucose, and also inhibits the conversion of amino acids or fats to glucose. All of these, through all of these functions, its role is to decrease blood glucose levels. Okay? That's the function of insulin. On the flip side, glucagon mainly has its effect on the liver. And so what it does is it basically takes, it's traveling to the liver, and it's going to take stored glycogen and break it down into glucose. And so it's basically mobilizing and causing the release of glucose into the bloodstream to be available to the body. So through all of the functions that glucagon does, it actually is responsible for increasing blood glucose levels. So let's take an example. So here's a question. Let's say that you are sitting in class and you didn't eat breakfast and you haven't eaten lunch, and it's like 3 o'clock in the afternoon. And so obviously your blood glucose levels are starting to plummet. And as I tell my youngest daughter, she starts to get a little hangry when that happens. So let's say you're sitting in class and you can tell that this is happening. Release of glucagon is going to increase in that scenario so that you can mobilize glucose release into your bloodstream to increase glucose levels in your bloodstream for your brain to use for energy, so that you can think and get through that class and then go get something to eat. Okay? So if you notice, we can kind of see this on here, we've got this balance of blood glucose levels. If your glucose level starts to drop, so your stimulus is decreasing blood glucose levels, it's going to stimulate the pancreas to release glucagon, which is going to stimulate the liver to break down glycogen into glucose, release that glucose into the bloodstream, and now we've just increased our blood glucose levels back up to normal again. So this is the scenario when you get hangry. This is what happens. And I kind of use that as a joke because we talk about that with my daughter all the time. It's kind of funny. On the flip side of things, if we have elevated glucose levels, so let's say that you eat a dozen wandering donuts for breakfast this morning, what just happened to your blood glucose levels? My gosh, it's very high, right? Increased blood glucose levels. That's going to stimulate the pancreas to release insulin, which basically it does a couple things. So one of its main functions is to now stimulate glucose moving from bloodstream into your cells, which is then going to decrease your blood glucose levels. It's also going to stimulate the liver to form stored glycogen from that glucose. So in all of those functions, it basically serves to decrease your blood glucose levels, thankfully back down to normal again. Okay? So antagonistic functions of both of those. So pathology associated with insulin is diabetes, and I'm sure everyone's familiar with this. We have our main types. Type 1 diabetes is basically what happens when you have a lack of production of insulin. So insulin's not produced by the beta cells, therefore you don't have the ability to pull glucose from the food that you eat into your cells. So blood glucose levels remain elevated. Type 2 is more common, and we typically call this like adult onset because a lot of times it happens a little later in life. And so what happens with this condition is that you typically continue to manufacture insulin, but it's more difficult for the body to use it. So we also call this kind of insulin resistance. So you'll see that term used too. But the pancreas is still making the insulin. It may be making less insulin, or the body just doesn't respond to the insulin like it should. So in both of these cases, you have blood glucose levels that remain elevated. Some cardinal signs of diabetes mellitus is polydipsia, which means an increase in thirst. So patients who have undiagnosed diabetes or poorly managed diabetes are going to be so thirsty all the time because they have this condition, polyuria, which is basically they have lots of urine volume. So glucose pulls water into the urine with it. You have so much glucose in your body, you start to actually like secrete glucose in your urine, which is one of the tests that they do for diabetes, is a urinalysis to check for presence of glucose. There's so much of it in your body can't reabsorb it all in your kidneys, and then you pee it out. So that glucose acts as a diuretic and it pulls water out with it. So your urine volume, you end up having increased urine volume. And so if you're peeing out more urine, basically you're going to become dehydrated. And so you have increased thirst, which is polydipsia. So it makes you really thirsty. Okay. And then polyphagia, which is basically this increased appetite. You may even see some initial weight loss with people with diabetes. Their body is not able to use the glucose. It just hangs out in their bloodstream, which can be very detrimental to the body. It's hanging out in the bloodstream. They don't have insulin to be able to pull it into the cells to use. So if you have patients who come in with symptoms like this and they just don't feel good, diabetes is always something to consider. So, okay, that's it for endocrine.